My name is Amanda Mendes. I am recording a sterile wound dressing change for New England Tech Nursing. Hi, good morning. My name is Amanda. I'm going to be your nurse today. Could I just have your name and date of birth? Perfect. Thank you very much, Mrs. Sim. Are you having any pain today? Scale of 0 to 10, 0 being the no pain, 10 being the worst. There's no pain today? Great. What we're going to do is we're going to remove the dressing on your wound and we're going to replace it today. Are you feeling any nausea when I do this? Nope. Any pain? Perfect. Let me lift your Johnny up a little bit. All right, I've already provided privacy, but what I'm going to do is I'm going to lift the patient's Johnny up to expose where the wound is and lower her blankets. So the wound is exposed. I do see from the tape, before I even put gloves on, I do see from the tape that this was done last night by one of my coworkers. So all I'm gonna do is I'm gonna do hand hygiene, apply clean gloves, place a chuck at the foot of the bed for trash. Okay, Mrs. Sim, I'm gonna remove this bandage for you. Please tell me if you're experiencing any pain. Still no pain, right, Mrs. Sim? When I remove the dressing, I can note the color, amount, the texture, and the odor. Now I'm going to be careful to remove the packing on the inside, as to be careful not to touch the wound. And put that in the trash. Now what I'm going to do is I'm going to palpate for bogginess. There is no bogginess. Is there any pain when I do this, Mrs. Sim? Any tenderness? Good. Now what I'm going to do is I'm going to take a cotton swab and I'm going to measure the depth of the patient's wound, going to the deepest part of the wound, bringing my fingers as close to the skin as possible but not touching. And the depth is about 1.5 inches. Now I'm going to measure the length and the width, being careful not to touch the wound or the patient. The length is about 13.5 centimeters by 2.5 centimeters. Now I'm going to clean all of this up, remove my gloves, perform hand hygiene. And now I'm going to set up my sterile field. Actually going to bring my table closer, set up a chuck again for more trash. I'm going to open my dressing change tray, being careful not to reach over it. Take out any trash that I don't need. Being careful to lift my sterile drape straight up and being mindful of the 1-inch border. Now I'm going to take my sterile kit, place it right in the middle, place it right on the side, being careful not to touch the inside. Now I'm going to check my sterile water. It was opened last night when they did the wound dressing change, so it's not expired. Now because it's already opened, I do have to lip it. Just going to place place a little bit of water in my tray, recap my sterile water, and apply sterile gloves. Just gonna bring my sterile fields that way a little bit. Being mindful of the edges, once again, the 1-inch border. Grabbing the inside of the sterile glove. Scooping this one up, making sure I keep my thumb away. Coming back around. Now I have to leave everything above waist level now because my hands are sterile. Undoing my first 4x4, placing it into the water, and my second 4x4, also placing it into the water, taking it apart first. Taking the last two 4x4s and placing them next to my ABD pad. Now I'm going to take my sterile swabs and clean the incision, starting with the center, working my way down, being careful not to hurt the patient. Discard. Doing the sides, turning slowly. Discard. And the other side. Turning slowly. Discard. Discard that. Now we're going to take our first gauze. And completely drain it, because we are doing a wet to dry packing. Taking the gauze and placing it inside the patient's wound. Being careful once again not to touch the outer edge of the wound. Now I grab the last gauze. Bringing that out as well. And once again placing inside the patient's wound. Being careful again not to touch the wound. Discarding those. Now this hand is dirty. I can no longer use this hand for anything, but I do keep it above waist level. I'm going to place the first dressing on the patient. First 4x4, but in a diamond shape, and the second also in a diamond shape. Now I can take my ABD pad, place it on the patient's wound. Mrs. Sim, are you having any pain? Good. Now I'm going to remove my gloves and discard my trash. Perform hand hygiene again. I'm going to take my tape and place it on my patient's ABD pad. Now before I started, I had already labeled my piece of tape with my initials, the date that I changed it, and the time that it was changed, right here in the corner. I'm going to cover my patient back up. Mrs. Sim, are you having any pain now that I've finished? No? Perfect. I'm going to lower the bed now, Mrs. Sim, and I'm going to raise the head of the bed for you. Your call light is right here. If you experience any pain, please contact me and I'll be back to help to assist you. I'm just going to raise the bed.